Hi everyone, I'm Dr. Coyers, and today I wanted to talk to you about Maternal Mental Health Week, which is taking place this week between the 4th of May and the 10th of May 2020. Now, before I carry on, I wanted to clarify. I'm not claiming to be a specialist in maternal mental health, but in my 19 years of education, training and experience in healthcare, I've seen a fair few cases, both professionally and personally. Today, however, I wanted to talk about a personal case which involves me and my family. So I'm very blessed to be the father of 3 beautiful, amazing children, and a husband to a beautiful, incredible wife. But this story relates to the birth of our eldest daughter, who is now 6 years old. I've spoken to my wife and she's happy for me to share this information, and I thought it was really important to raise the issue of maternal mental health so that we can all recognise it and manage it better, especially when, sadly, so many women may be suffering in silence. So going back to 2013, before my daughter was born, like many pregnant women, my wife's pregnancy wasn't without issues. On a professional level, I see pregnant women regularly with problems such as excessive sickness or hyperemesis gravidarum, or abdominal pain and bleeding. And unfortunately, we had a few issues during the early pregnancy, but thankfully there were no major problems. But these symptoms can cause a lot of anxiety, especially if there's a risk of miscarriage or another serious complication. So I think it's really important that we are there for and supporting our partner, family member, friend, or whoever it may be. And so I tried my best to always do this. The main issues, however, came during the labour process and the birth itself. Firstly, I want to give a huge amount of respect and appreciation to all the women out there who have been through childbirth. You're amazing. When we got to the hospital, things were going very slowly, so various interventions had to take place to help speed things up. This even included an epidural for pain done by one of the anaesthetists who happened to be one of my friends and a junior colleague who was working with me a few years beforehand. But soon after, unrelated to the epidural, the problems began. My wife's teeth started chattering and she became agitated. The midwife initially didn't think much of it and thought she was just anxious, but I could sense something wasn't right. Perhaps it was my medical instinct kicking in, or perhaps it was just the bond that we have, but I could see that my wife was becoming unwell. I asked the midwife to check my wife's temperature, and she developed a low-grade fever. But soon after, the temperature began to increase towards 40 degrees Celsius, and her heart rate became dangerously fast, over 150 beats per minute. At this point, I just wanted to get involved, putting in a cannula, setting up fluids and some antibiotics, doing an ECG and further tests, but I just knew I couldn't and I shouldn't. The emergency team were called in, and my wife was rushed to theatre. She was obviously distressed, but I remained by her side, holding her hand and reassuring her, even though I myself was really worried. Although we planned for a normal, natural delivery, the obstetricians were getting ready for an emergency caesarean section. But this wasn't what my wife wanted, and I knew that. And she's strong, stronger than I could have ever been. And so, despite her being seriously unwell, she put in every last ounce of effort she had and managed to successfully give birth via forceps delivery as the ventouse had failed. She was just seconds away from being operated on. When our daughter was born, it was just the most amazing feeling I've ever felt. Those who have children, I'm sure, can relate and will be able to understand this incomparable feeling, where it's like nothing else in the world is happening then, and nothing else matters. It's such an emotional feeling, and it's impossible not to cry. When you see your baby's head appear and then burst into tears soon after, the feeling inside is indescribable. It's the best feeling ever. But during all of this, my wife was still unwell. She lost lots of blood and passed out briefly after delivering. She then came round and didn't see the baby, who'd been taken away to be checked over. Understandably, she was shocked and distressed, wondering where our daughter was. I reassured her everything was fine. Our daughter then returned and my wife held her really close to her chest, saying she felt okay now. She told me afterwards she thought we'd lost the baby. If I'm completely honest, at one point, I thought I was going to lose my wife too. Following antibiotics, blood transfusions and visits to NICU for my daughter, after several days both my wife and daughter came home. It was one of the happiest days of my life. But the experience my wife went through was traumatic, to say the least. It could have really scarred her. I tried my best to always help. I always tried to be there for her and support her. We talked regularly about how she felt, and I offered a shoulder to cry on if she ever needed it. And I even tried to take my doctor hat off whenever I could and just try to be the best husband I could be. Thankfully, she didn't develop any long-term mental health issues. And although my wife burst into tears at our first postnatal appointment when the midwife asked her how it went, she was fine soon after. We were so fortunate she didn't develop baby blues, postnatal depression, or any other significant issues. And the following 2 pregnancies, from a mental health perspective at least, were much better and far less traumatic. I think the moral of the story is, be there for your partner before, during and after the pregnancy. Perinatal mental health problems affect between 10 to 20% of women during pregnancy and the first year after having a baby. It's so important that we are there to support, look after and be there for our loved ones, even if it's just someone to talk to and offer a shoulder to cry on if needed. But please don't forget about your mental health either. Pregnancy, childbirth and things related to this can have a huge impact on the partner too, and we must not ignore this. So please seek help if you or your partner need it. I'll leave some links in the comments below, which I hope you will find useful. Wishing you all the very best, and thank you for watching.